Hi, my name is John Aman. Today I am going to talk about the acute infectious diarrhea in immunocompetent adults. Definition: diarrhea is generally defined as the passage of the 3 or more unformed stool per day, often in addition to other enteric symptoms, or the passage of more than 250 grams of unformed stool per day. On the basis of its duration, diarrhea can be classified as acute, persistent, or chronic. Gastroenteritis, which is often due to viral infection involving the stomach and small intestine, is associated with vomiting and diarrhea.
Nobody likes diarrhea. Now, diarrhea by itself is a whole other deal than the stomach bug where you get nausea, vomiting, and diarrhea. When you just have diarrhea, that can come from several different causes. It can be a virus, it can be a bacteria, it can be a parasite. You usually know that because the stool and the gas is very foul smelling. It can be things like irritable bowel syndrome or certain foods that your body doesn't react well to. Now, diarrhea is usually short-lived and it goes away pretty easily. You can treat it by avoiding dairy products because that tends to promote diarrhea, going on a clear liquid diet for about 6 or 8 hours. That's anything you can see through, like Coke, water, Gatorade, tea, 7-Up, ginger ale, that kind of thing. Now, the warning signals for when diarrhea is something bad and you need to get some help is if there's blood or pus in the stool, if you have a lot of pain, if you have a significant fever, anything over 100, that's a bad sign. Or if you have diarrhea and have recently traveled. The traveling diarrhea and traveler's diarrhea from going to third world countries can be bad. You just don't know if it's a virus, a bacteria, or a parasite, but your physician should be able to help you.
Application in medicine. These signs or drugs and among persons with physical features of the gut that are altered by medication include acid-reducing agents such as a proton pump inhibitor and antibiotics that alter intestinal flora and gut homeostasis. Pros: anti-secretory drugs are involved but remain understood in most forms of diarrhea. Empirical antibiotic therapy is recommended for case of feral dysentery, especially those associated with toxicity that suggest the possibility of systematic infection. Cons: genetic variants that mimic the effect of a therapeutic agent cannot anticipate potential drug specific adverse effects of a therapy that is not related to its mechanics of actions. Issue applied in Ecuador. From a total sample of 148 patients, an average age of 35 years was obtained where the possible etiology of acute diarrhea. It was related to the managed performance, where determined the case symptoms to make the diagnostic and different treatment. Where this was found that only 45% had liquid phase. It's a smaller percent apparent stool with mucus and abundant, and the other characteristics were described sparingly. Conclusion: the patient's hydration status should be evaluated by examining vital signs, mucous membranous and sensoriums, and looking for a postural hypotension. The examination may reveal evidence of a systematic process. Peripheral hemorrhoid from frequency defecation may be detected in patients with colitis, prostatitis, or both. A rectal examination should be performed to assess stool for growth and occult blood.
How to treat diarrhea. Symptoms of diarrhea include frequent loose stools, abdominal cramps, and dehydration, all of which are uncomfortable for you or your children. Because diarrhea is usually not a serious illness, it can easily be treated at home. You will need fluids, clean hands, and a doctor. Step 1. Treat your child's diarrhea at home by increasing fluids that help replace electrolytes, like sports drinks. For babies, offer them additional breast milk or formula. Avoid plain water, fruit juice, and sodas. Step 2. Continue your child on their regular diet. Step 3. Frequently wash your hands and your child's hands. Keep suspected diarrhea-contaminated areas clean. Step 4. Consult a doctor if your child's symptoms do not improve within 24 hours. Call a doctor if your baby has not had a wet diaper in over 3 hours, has a fever higher than 102 degrees Fahrenheit, is unusually sleepy, has a dry mouth, or has bloody or black stools. Step 5. Treat diarrhea in adults by drinking plenty of clear fluids such as water, broths, and gelatins. Avoid coffee, alcohol, and apple and pear juices. Step 6. Gradually add solid and low-fiber foods such as soda crackers, toast, and chicken. Avoid dairy products, high fiber, and fatty foods. Step 7. Consult a doctor if you are an adult and the diarrhea lasts longer than 3 days, you are dehydrated and have had severe rectal or abdominal pain, bloody or black stools, or a temperature above 102 degrees Fahrenheit. Eating the right things, or getting the right advice from the doctor, will have you back to your regular self in no time. Did you know? Acute diarrhea is commonly caused by consuming food or water contaminated with a viral infection, bacteria, or parasite.